Post-operative instructions, general extraction. If you are scheduled to have a tooth or multiple teeth extracted, it is important that you carefully follow these instructions. Discomfort is normal after the extraction of teeth. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, begin taking ibuprofen, also known as Advil or Motrin, as instructed by your doctor at the time of your surgery. If your pain is not controlled by the ibuprofen alone, take your prescribed narcotic in addition to the ibuprofen. Ibuprofen and your prescribed narcotic may be taken together. Be certain to take your pain medications with food to help prevent nausea. Remember, narcotic pain medicine will impair your judgment and reflexes. Gauze pads should be placed directly over the extraction sites and held in place with firm biting pressure. Proper placement will help prevent you from swallowing blood, which can make you nauseated. Replace the gauze pads every 20 to 40 minutes. When gauze pads have little or no blood on them, they are no longer necessary. The amount of bleeding will vary from person to person. Most of your bleeding will slow within 3 to 4 hours, but a small amount of bleeding is common for up to 24 hours. Do not rinse your mouth on the day of surgery, as it may prolong your bleeding. Begin saltwater rinses on the day after surgery and continue for 1 week. Rinse with warm salt water 3 to 4 times each day. To make a saltwater solution, dissolve a half teaspoon of salt in a small glass of warm tap water. If you have been given an irrigation syringe, start irrigation 1 week following surgery. Fill the syringe with warm salt water and place the tip of the syringe into the extraction site to clean. Repeat 3 to 4 times a day for 2 weeks and decrease as the surgical site heals. Swelling is normal after surgery and is a major cause of post-extraction discomfort. Typically, swelling peaks by the 3rd day and then starts to resolve. Swelling can be reduced by the use of an ice pack. Apply the ice pack to the side of your face for 15 minutes. Transfer to the opposite side for another 15 minutes. Continue icing your face for the first 24 hours and avoid freezing the skin. Ice packs are useful for the first 24 hours only. Also, keep your head elevated on pillows for 2 to 3 days. These measures will not eliminate swelling, but they will help to reduce its severity. To help with medication tolerance, we recommend that you eat right away after your surgery. Start with clear liquids such as broth and gradually ramp up your diet as tolerated. Always cool down any hot foods or liquids during the first 24 hours. If you were sedated for surgery, do not eat fatty, creamy, or oily foods, as these types of foods may cause nausea. You should eat only soft foods for the first 2 to 3 days, such as soup, eggs, mashed potatoes, and meatloaf. To help prevent a dry socket, do not use a straw for the first week after surgery or brush your teeth until the day after surgery. It is important to brush all of your teeth, even if the teeth and gums are sensitive. Bacterial plaque and food accumulation near the extraction site will delay healing. Do not smoke for at least 1 week, as smoking will increase your bleeding. The nicotine and tar in tobacco impair healing and may cause a dry socket. Unless otherwise advised, avoid vigorous physical activity for 3 days following your surgery. Physical activity increases your blood pressure, which can worsen your swelling, pain, and bleeding. You may gradually increase your activities to jogging or tennis 5 to 7 days after your surgery.